We have Deepa Mankikar on the line with us today to discuss the COVID vaccine toolkit that NNCC has put together as a resource for a variety of frontline workers, such as nurses and community health workers, to address vaccine hesitancy, right? So Deepa is a senior project manager at NNCC and specializes in public health programming that support families' health and well-being. Deepa, thank you so much for being here. We really appreciate it. But before we hop into the toolkit and everything COVID related, one, who are you? And how'd you, and it's always helpful to know who we're talking to, right? And how'd you get involved with this work?
Sure. Thanks, Kevin. And hi, Kelsey and Kevin. Thanks for having me on today. So a little bit about me. So I'm a senior project manager at the National Nurse-Led Care Consortium. My background is actually in environmental health, thinking about different ways to provide education to the public and helping people understand how the environment, health, housing, all of that is connected. As the case has been for many of us in the past year or so with COVID, that work has sort of shifted a little bit. I've been brought in a little bit more on our training and technical assistance side. So NNCC, we have a big part of our organization is providing national support to different types of healthcare entities, nursing professionals, helping them strengthen their workforce. We offer a lot of different trainings for a variety of topics, the latest being COVID. And so because we already had that, extensive reach across the country to nurses, nursing organizations, we were grateful to get a grant actually from the US CDC to, build on those connections and use that to provide accurate, timely information about COVID. And so we've been in this partnership with the CDC now, working with nurses around the country, hearing about what barriers they're facing at the community level, and thinking about what kinds of trainings or resources we can develop to make their jobs hopefully easier, and just support them throughout this pandemic.
No, thank you for that. And I actually had one follow-up question based off of something that you just said, right? Not just said, but think about your environmental background and just thinking about do you see any connections about, the environmental space and how COVID has impacted maybe families who may, have been in certain programs that you have led out in the past? How do you see that connection when it comes to COVID-19 and environmental health?
Oh, yeah. Well, sure. So, one of the big programs we had going on during this pandemic was our Safe and Healthy Homes program. And, that along with other nurse home visiting programs that we do at the NNCC. And typically those programs will have community health workers, nurses going into homes, meeting families where they are in the community. And, we're based here in Philadelphia. And it took a couple, after word got around the pandemic, we still tried to continue our services as much as possible, but then it got to a point where we were like, our staff are our safety, our families are, our priority. And we are all sort of upon agreement that, okay, we need to sort of change what we're doing. So we did actually have to pivot our services a little bit and move to a remote, online format, which was, really difficult because the staff going into homes, that's their livelihood. They really, truly get joy from meeting people in their homes. So it changed a lot about what how we've been able to interact with families, but it also highlighted a lot of things for us. Some of those were maybe issues that we already knew existed, like housing conditions and, having old housing, like how we have it in Philly and many cities across the US, pest issues, things that can exacerbate asthma, especially in the beginning of the pandemic, because there were all of these policies for staying safe at home and, quarantining at home and, all of that. It's a big struggle in big cities when you're spending so much time at home and that home has, is old housing, might have chipping, peeling, lead paint, could have different pest issues. And if there's landlord tenant issues, that is really tricky situation because you want to keep things as amicable as possible. So there were a lot of, and these issues were prevalent before we know about them, but we felt it harder because it was harder to actually help our clients during this time. And it felt like a lot of times we were referring people off to other agencies or for involving legal assistance. And we do have some good outcome stories that came out of this, and we were able to help out families. We were able to get heaters to families whose landlords might not be providing them heat, even though they should be. So I think really our organization went above and beyond. And I know of the nurses at our organization have an emergency fund that they put together and started using that just to provide this additional support for people during the pandemic. So we know even at that level what the pandemic has been like and what kind of impact that's had for the families that we serve and the community, facing staff that are interacting with these families. We're all, we have just started sort of resuming some of those home visits for some of the nurse home visiting programs. And I know that means so much to those families and for our staff too. So, I'm hoping that we can get back to some of that, but in the meantime, it's all sort of lessons learned that we're taking and seeing, how we can improve upon ourselves and in the future when we get back into homes.
Yeah, no, definitely. I mean, and we'll definitely get to the toolkit very soon, but I just wanted to definitely just ground the conversation, like the real world kind of implications, right? For sure. So I know, Kelsey, I'll let you get like a word in here. I know you want to, talk about this toolkit that NNCC had created. So Kelsey, it's all on you.
Yeah. So, I mean, it definitely, whenever community health and environmental health are involved, it's definitely, there's a niche where a pandemic would take hold and cause a lot of disruption. So I guess wanting to hear from you on this COVID-19 toolkit that NNCC has put together, and how is this toolkit combined to support community health workers, and what's the function and utilization of it?
Yeah, so I guess to step back a little bit, because there's been so many different activities that have taken place in the past year with this project. We recognized early on the importance of having people have access to those trusted voices for getting COVID-19 vaccine information. And we actually follow a number of different national polls, and one in particular, so the Kaiser Family Foundation, they're a nonprofit. They do excellent work focused on national health policies, and they track public perceptions of the vaccine and how those trends sort of change over time. And some of the things that come out of those polls are, consumers or the public prefers to hear COVID-19 vaccine information when it comes from their own primary care provider or nurse or doctor. And we know that nurses have been voted the most ethical and trusted profession for the past several years. And so, we really do understand how impactful it can be hearing from your own nurse or primary care provider, or even just that healthcare provider voice. And on the local level in Philadelphia, we've worked closely with some community health workers in our own programs, but then also around in the city for other programming. And what they've told us, what we've learned from them, is that it can also be really encouraging to hear this information from a colleague in your role. So, it can be really helpful for people who are out in the community working with families to hear this information from somebody else who's in their shoes and gets it and understands the value of that conversation, and sometimes how much of a struggle it can be to move that conversation along with someone. So taking all of that into consideration, we really worked closely with a group of 20 nurses that we have as a committee from around the country, our Vaccine Confidence Advisory Committee. They're a great bunch, and they really helped inform the materials we were developing and provided feedback along the way. We also took some feedback from our community health workers as well about what types of messages could be helpful. And we also asked them, what questions are you getting about the vaccine? Because we wanted to know, like, what are the most common questions and how can we help address that, address any myths? So we really did take all of that into consideration when creating our toolkit, because we want it to be, the most impactful and the most helpful for people to promote among their networks.
Yeah, that's really fantastic. And gathering that information from trusted and valued members of our communities and our society is a really wonderful resource to engage in order to kind of develop a resource. So I guess, you had mentioned before the importance of hearing from these trusted medical professionals, and research has continuously demonstrated different communities and how they respond differently to messaging techniques. I guess just wanting to hear from you on how this tool utilizes different messaging techniques to address vaccine hesitancy within different communities.
Yeah, so that's absolutely correct. I think, and we all sort of know that, right? Like different communication formats will resonate with different people. So it's often helpful to use a combination of videos, images, personal storytelling. So we were, when we were kind of surveying what types of formats people like to listen to or respond to, engage with, these were the top ones that were sort of coming up among our audience. And so in our toolkit, we wanted to make sure that we incorporated elements of all of that. So there was something in there for everyone, sort of. So, we have these nurse stories. If you can get by listening to someone like a nurse sharing their story and feel like that would empower somebody else, that might be a resource for you to share. We also have like images that just recap really quickly, like vaccine facts or confront myths that are out there. That can be great for social media. So, we're just thinking of, and then we also have like these printable sort of infographic posters. Maybe you work in a clinic and you want to post that in a waiting room. So we just are thinking about all the different ways that we can get information out there. Information, knowledge is power. And so we really just want to put that power in people's hands and feel like, okay, I have the tools that I need to get the information out there. And I will say, we haven't figured it all out, right? We are living through these times. And so we're learning as we go. And we recognize that, like even in the next couple of months, we might have to go back and adjust some of that messaging or come up with new messaging as things evolve. So, we want to keep it fresh, but also understanding that we have to change things as we go and be ready to evolve if we need to.
Yeah, no, for sure, Deepa. That's great right there. And just thinking about this toolkit, right? And there's been so many toolkits, so much information about COVID-19, right? We're literally being buried in it every day, like so much information, right? But just thinking about like our, NNCC toolkit that was created, what do you think about it that's so fundamental, like to like frontline workers, and that you feel like maybe like what's different about this toolkit versus other ones that you've seen, like about these resources and different things like that?
Yeah, well, that's a really good question. And you're right, there's so much information out there and so many different organizations sharing the same or similar information. When we were creating this toolkit, that was one of the things, like we did a little bit of research about what's out there. And we wanted to be most effective with the time that we have, the energy that we have. And if someone is doing a great job at something, we don't want to reinvent that, right? So there are some groups that are doing a really good job of like tracking this information real time. Public Health Communications Collaborative is one that I'm always going to and telling people about. There are other groups who have a bunch of printable like vaccine infographics. So, we were really thinking about what can set us apart. And when we spoke with community health workers and nurses locally and also around the country, a lot of them told us like, we're getting overburdened with information. We have a lot of information, probably too much. And so it was more about how do you get to that next level? Like we have the facts, but how do I know how to approach a conversation? And so it's more like people are interested now about role playing or like preparing for patient conversations on that next level, like kind of anticipating what's going to come next and having some ideas in their mind about how to approach it in case the patient responds a certain way. One of the tools we have in there, it's a vaccine hesitancy guide, like a reducing vaccine hesitancy guide. And I think that's awesome. What it does is we kind of cover some commonly asked questions about COVID, but we also provide some compassionate responses for people to consider if you're met with some level of hesitancy from someone you're speaking with and maybe are stuck at a crossroads of, oh, I don't really know how to get past this. So we're starting to think about how do you provide people guidance for a conversation that goes beyond just the facts? Facts are definitely important and necessary, but how do you go that step further, like pairing that with a personal story or, connecting with someone on an emotional level, that deeper level. So that's how we're sort of setting ourselves apart and trying to recognize that it really takes more than just the facts to connect with somebody and encourage that behavior change.
You're absolutely spot on. I think also like there is always room for, innovative and creative methods of, designing and preparing resources to folks and preparing healthcare workers and frontline staff with the tools necessary to provide, a trauma-informed harm reduction approach to care. You had mentioned kind of the guidelines and pairing and connecting within the toolkit stories with facts and providing this to healthcare workers to have a more effective conversation for different members of the community and tailoring that to specific populations. Mm-hmm. Would you say that's maybe your favorite feature of the toolkit, or what aspect is your favorite if that one isn't?
Yeah, yes, I think a great part about the toolkit, and there are many parts, is that you can really like mix and match some of these, right? It's like, yes, like I said, it's still really important to share the facts and confront the myths. So if you have like the infographic, you can share that, but also pairing it with maybe one of the nurse stories. I love the nurse stories. We were able to interview some nurses around the country, and there's just something special about hearing that firsthand account of someone who's caring for patients who have suffered from COVID. And these nurses go on to kind of share their experiences caring for these patients and also their own personal experiences, what led them to get vaccinated and how they're promoting vaccination in their community. So it kind of is this opportunity to hear from nurses in a different way. We always, sometimes we tend to put healthcare providers up on a pedestal as being our heroes. And what we've heard from nurses this past year is that, I don't see myself that way. I'm a human. And I think when you take a moment to listen to these personal stories, it does humanize our healthcare workforce as well. And that helps people relate to them. And it helps us understand really the sacrifices that they're doing, which is amazing on another level. But really how they're juggling that like personal life, work life, and still working to empower the community and always wanting to do more and being able to motivate people and, promote public health. So I love those nurse stories. It's something unique. We want to do more of that this coming year. But that's one of my favorite features. And another piece I will say is one piece that we got a lot of comments on and positive comments on is we developed this timeline for vaccine development infographic. And going back to that, the Kaiser Family Foundation polls that they do, they were surveying the country around top reasons that people cite for being unvaccinated. And one of the top reasons is concerns around how fast the vaccines seem to be developed. And that's a myth. So, the technology behind the vaccines, the mRNA technology, that was being studied for over 20 years. And it was actually applied for other viruses, like the virus that caused the SARS outbreak in 2002, 2003. and successfully, helped us create a vaccine against that. And so when COVID came around, we weren't working with nothing. We had that foundation that was built from 20 years ago. And so it was really scientists looking at that and saying, okay, well, here's what we have. Now we're dealing with a different virus, the SARS-CoV-2, but let's see how we can apply what we've already done and build this COVID-19 vaccine. So it's really important for us to share that it didn't happen overnight. And it was really built on this foundation of research that was going on for like 20 years or more. And when we got this question a lot ourselves as well. And we actually would Google around and we're trying to look up an easy way to explain it to people. And we couldn't find anything. It was just like different pieces of information, but we don't want to send somebody to like 5 different articles, right? So we thought, why don't we just create our own resource? So we, gather this information about vaccine research, how it's developed over time, how it led to this development of the COVID vaccine. And we put it all on one page. So you can print that out, you can share it on social media. So those, that's another piece I just wanted to highlight there that we're pretty proud of.
Yeah, no, that's tremendous because, just thinking about what you're saying, right? You're kind of saying like a lot of stuff like around like nuance on social media, right? That may be like a really difficult thing to try to achieve, right? Like putting out information, putting out stories, but also see it as like putting like taking back the narrative about like things that are true and are not true, right? How do we kind of take back those kind of different narratives, right? So thinking about like, the most integral part of this toolkit is the social media aspect, right? You kind of talked about the messaging and different populations, different communities. So, having this toolkit, being on social media, putting in the different narratives and stories out there, who do you think like this toolkit is for? Like we kind of mentioned like a lot of frontline workers, we mentioned nurses, we mentioned, all kinds of populations, right? So who like it was created, it's on our website, it's on NNCC's website. But who do you like, imagine reading this, taking things from it, bringing it back to their community, bringing it back to their families and things like that? And how can folks become a part of this kind of movement?
Yeah, that's a great question because there's, again, so many resources out there. What makes this special? Who is this for really? And I will say that the resources in this toolkit have been made for everyone, the general public. The way that they're written, it's like almost having a nurse's voice in your mind. And so our idea is that it can be shared by nurses, by community health workers, by community facing staff, but it can also be shared by just the general public. So we have a social media campaign aspect of the toolkit, and you can actually go and like download the pack, and you have ready to go posts that you can just share on your own platforms like Twitter, Facebook, whatever. And our hope is that, if you are following a frontline worker on Twitter or you're friends with a nurse on Facebook, that you would see these posts from them and then be maybe inspired to share that with your network and say, hey, here's a nurse sharing this. This is great information. Let me get the word out as well. So that's sort of that trickle down effect that we're hoping for. But really the facts, they are relevant for everyone. Like we want to get the word out. There's so much to engage with in the toolkit. And really, like if you're a person who has so much coming across their feed, they want something quick and easy. I'd also say another option is to follow NNCC on our social media platforms. And we can maybe drop those in a link in the description below or something. But that's really easy because then whenever we're posting, and we're posting like every day about these different vaccine facts and addressing misinformation, you can just, click and share, make that a little easier upon yourselves. But yeah, so again, thanks for having me on. And I wanted to just do one plug for checking out our toolkit at www.nurseledcare.org/toolkit. And like I said, we just launched all of this, so we'd love to hear what people think. We are, always fielding feedback from everyone and trying to incorporate it and improve. So yeah, if you check out our toolkit, let us know how we're doing, what's missing, how we can do better. Yeah.
Amazing. So you heard our folks. Go check it out. Provide some suggestions after you review it, and let us know how we're doing. But all right, everyone, that's the time we have. A huge thanks to Deepa for providing this wonderful resource. Tune back in with us September 29th, where we'll have a guest from Nurse Family Partnership to discuss issues to care and resources as it relates to mothers pregnant with their first child. Remember to stay masked, promote social distancing, and get vaccinated. We're here to spread the word, not the germs. Thanks, y'all.